The real issue, of course, is to what extent you can do anything about Medicare and Social Security. Now, one thing I do give the President credit for, and I don't give him much, but for trying to do something about Social Security, I think it was the right direction. The idea of creating these personal accounts and voluntarily allowing people to move into them, especially as they come into the workforce. I think that kind of structural change has to happen in Social Security. I think the same thing has to happen, a structural change in Medicare. That one is, I think we ought to really start to concentrate on getting the government. It's really a reduction in all these cases. To tell you the truth, there's a common theme, and that is a reduced government involvement in the specifics of the program. If it's education, if we're going to continue in education and you want to continue to provide support, you can do it through a block grant to the states and then allow them the greatest latitude, because that's where the decision should be made. That's where the Constitution says it should be made, and that's where the better decisions are made. In health care, it's sort of the same thing. I wish that we could reduce the amount of federal government involvement in the minutia of, who's going to be the provider, how much we're going to pay for the particular service. These are all things that the government really doesn't have a good way of monitoring. That's one of the reasons why the costs of the system are so high. And so we should move from the idea of a guaranteed benefit to a guaranteed contribution, so that you have both in Social Security and in Medicare, you have the government's contribution to the whole process is one where the individual takes charge. And in Medicare, I would like to see us voucherize the system, provide the support to you as a Medicare recipient for the purchase of an insurance plan that fits your needs. You can add to it to the extent that you want, but you would always have enough to buy the minimum. And so you then have control. And at that point, you have this whole panoply of things to choose from. Today you don't, because, what insurance company is going to get involved in offering health care to anybody age 65 or over? What's the market? It's just not there. So, but I have, as a federal employee now, I have this great opportunity. Every year, there's this open season where I can choose from, I think there's 13 or 14 different plans, companies, who all come in every year. And I have gotten better. It's probably unique in society, but over time I know that my plan has gotten actually better. We just changed from my family just changed from Kaiser to Blue Cross Blue Shield, but it's a fine plan. Now, why? It's because lots of people competing for this for your business, and a lot of business to be had. You're talking about all federal employees. Well, that's the thing. You have to figure out a way to get greater competition into that marketplace. And the way you do that is by allowing people to actually become the real consumer, not the government. And so that's the direction I would like to see Medicare go.